In this lecture, I am going to talk about antimicrobial resistance, the definition, causes, and also explain in details about the mechanisms of antibiotic resistance. So going back to the history, we all know that Sir Alexander Fleming identified penicillin in the year 1928. In 1945, in his Nobel Prize lecture, Fleming himself warned about the danger of antibiotic resistance. Nearly 80 years have passed and his words have come true. There is an increase in antibiotic resistance. The susceptibility or sensitivity of the microorganisms to various antibiotics is decreasing day by day. So antimicrobial resistance has become a global challenge known as the silent pandemic. So now let's understand antimicrobial resistance. Now the germs are present in the environment, community and healthcare settings. And antibiotics kills germs, but the germs find new ways to survive. So these defense mechanisms against the antibiotic is known as resistance mechanism. So how do we define antimicrobial resistance? WHO defines the resistance of the microorganism to the antimicrobial agent that was initially used to treat infections caused by it. So antibiotics that were initially effective against the organisms no longer work. They are no longer effective because the organisms have acquired resistance to the antibiotics. So what are the causes of antibiotic resistance? Overuse and misuse of antibiotics is the single most important cause that is responsible for the development of antibiotic resistance. The patients not completing their treatment, so lack of compliance or adherence to treatment contributes to resistance. For example, for the management of tuberculosis, the patient needs to be followed up and compliance needs to be monitored. Thirdly, overuse of antibiotics in livestock and fish farming can also lead to antibiotic resistance. Poor infection control practices in the hospitals and clinics, lack of hygiene and poor sanitation, and lack of new antibiotics being developed. So as the resistance is increasing day by day, sensitivity of the organisms is decreasing, the susceptibility is decreasing, the antibiotic development is decreasing. So lack of new antibiotics in recent times leads to further worsening of the situation. So what are the mechanisms of antibiotic resistance? Antibiotic resistance is classified as innate resistance and acquired resistance. Innate resistance is the ability of the bacterium to resist against the antibiotic because of its structural and functional characteristics. An example is Pseudomonas aeruginosa, which is a leading cause of hospital-acquired infection. It is difficult to treat organism, and this is because of the structure of the organism that limits the access of the antibiotic to the target site. The other type of resistance is acquired resistance, which is emergence of resistance. So the antibiotic that was initially effective no longer works. So the organism that was initially susceptible to the antibiotic now becomes resistant by acquiring the genes responsible for resistance. So by acquiring the genes for resistance, the organism that was initially susceptible becomes resistant, and this is known as acquired resistance. So the acquired resistance can further be subclassified as mutational resistance and extra chromosomal or transferable resistance. So what is mutation? Now mutation means a change in the structure of the gene that confers resistance to the antibiotic. An example is Mycobacterium tuberculosis. So this is a low level of resistance that acquires to one drug at a time when used for a prolonged period. So this type of resistance can be overcome with combination therapy, and this is the reason why for the treatment of tuberculosis, first line drugs are combined together for the management of tuberculosis. Secondly, the extra chromosomal resistance is also known as transferable resistance, where the antibiotic resistance moves from one bacterium to another with the help of mobile genetic elements, and these genetic elements includes plasmids, transposons, integrons. So we will discuss in details about the acquired resistance. Now first let's see what is innate resistance. So now going into the details of antibiotic resistance, so we will first discuss innate resistance. So this is a mechanisms of the bacterium against the antibiotic. The common mechanisms are inactivation of the antibiotic, and this is due to the production of beta-lactamase enzymes. So beta-lactamases are produced by both gram-positive and gram-negative bacteria, and these enzymes can hydrolyze or degrade the beta-lactam ring, which is an important component of penicillin. The second mechanism is altered target site. As we can see here, the target site is altered or modified. So although the antibiotic enters into the bacterial cell and binds to the target site is altered, it is modified, so the further action is inhibited. An example of this type of resistance is methicillin resistant Staph aureus. Now here methicillin binds to penicillin binding protein. So the target site is penicillin binding protein, and because of the alteration of penicillin binding protein, methicillin fails to act on the target site and no longer is effective. The second example is that of vancomycin resistant enterococci. So this is also a type of resistance, and this is due to alteration in the target site, and here the target site is D-alanine of peptidoglycan side chain. Because of the modification of the side chain, because of the modification of the target site, the antibiotic, that is vancomycin, is no longer effective. The third mechanism is decreased permeability of the antibiotic into the bacterial cell. So as we know that gram-negative bacteria have an outer membrane and there are porin channels. So there are porin channels that facilitate the entry of the antibiotic into the bacterial cell. Now, because of alteration in the porin channels, because of the modification in the porin channels, the antibiotic entry is inhibited. So the antibiotic entry is inhibited, the antibiotic does not easily penetrate into the bacterial cell and thereby rendering the antibiotic ineffective. So the common mechanisms that confer innate resistance are inactivation of the antibiotic because of the production of enzymes, and these enzymes may be beta-lactamase enzyme or acetyltransferase enzyme. The second example is modification of the target site, and the examples are methicillin resistant Staph aureus and vancomycin resistant enterococci. The third example is decreased permeability into the bacterial cell because of the alteration in the porin channels that facilitate the entry of the antibiotic. An example is Pseudomonas aeruginosa. Fourth, the efflux pumps expel the antibiotic, rendering the antibiotic ineffective. So now let us see what is acquired resistance. The figure here shows the mechanism of acquired resistance. So now what is acquired resistance? It is the emergence of resistance in the bacteria that was initially susceptible, that was initially sensitive, but has now become resistant by acquiring genes for resistance. So in presence of the antibiotic, the sensitive bacteria dies, but some of the bacteria become resistant, they survive and they become resistant. Now these bacteria further grows, multiplies and can spread resistance between bacteria. Now the acquired resistance can further be categorized as mutational resistance, where there is a mutation in the gene structure. For example, Mycobacterium tuberculosis, this is a low level of resistance, and here resistance develops to one drug at a time, can be overcome by combination therapy. Now the second type of resistance is transferable resistance, where antibiotic resistance moves from one bacterium to another, from germ to germ, and this occurs with the help of extra chromosomal genetic elements. So these extra chromosomal genetic elements are plasmids, transposons, integrons, bacteriophages. Now let's see what are these extra chromosomal genetic elements mean and how do they transfer the antibiotic resistance. So what is a plasmid? A plasmid serves as a carrier of DNA molecule. It is capable of self-replicating in the cytoplasm. It is capable of replicating independently on its own. And much of the resistance that is encountered in clinical practice is plasmid mediated. Now the second type of extra chromosomal genetic element is transposon. Now transposon is also a carrier of DNA molecule, but it does not have the ability to self-replicate like plasmids. but it is capable of self-transfer. So it transfers the resistance from plasmid to plasmid or from plasmid to chromosome. The third type of extra chromosomal genetic element is a bacteriophage. Now, bacteriophage is a virus that infects the bacteria, that replicates in the bacterium and transfers the resistant gene to the target bacterium. So this is how resistance is transferred to the bacterium. So this is a figure which shows the mechanisms through which the resistant gene is transferred from one bacterium to another, and these mechanisms are conjugation, transduction and transformation. So the most common mechanism through which the antibiotic resistance is transferred is conjugation, where a conjugation tube is formed between the two bacteria. As you can see here, a conjugation tube that is formed between two bacteria through which the exchange of resistant gene occurs. The resistant gene is transferred from one germ to another with the help of conjugation tube, also known as sex pillars. The second mechanism is transformation, where the bacteria picks up free DNA. It randomly picks up free DNA from the environment, and this new DNA gets incorporated in the genome of the bacteria and the bacteria acquires resistance. So transformation is the process through which the free DNA from the environment is picked up, it is incorporated in the genome of the bacteria and the bacteria then becomes resistant. The third mechanism is transduction, which involves a bacteriophage. It is a virus which infects the bacteria, transfers the resistant gene to the target bacteria. So to sum up the resistance mechanisms, they can be classified as innate resistance and acquired resistance. In innate resistance, the structural and functional characteristics of the bacteria resist against the antibiotic. And in acquired resistance, the bacteria acquires the resistant gene and becomes resistant. So acquired resistance can be chromosomal or mutational and extra chromosomal. In chromosomal, there is a change in the genetic structure. It develops to one drug at a time. It is low level of resistance. An example is Mycobacterium tuberculosis. In transferable resistance, extra chromosomal genetic elements are involved in the transfer of the resistant gene, and these are plasmids, transposons, bacteriophage. This is a high level of resistance, and this type of resistance develops to many drugs at a time. And the mechanisms through which the transfer of resistant gene occurs is conjugation, transformation and transduction. Conjugation is the most common mechanism of transfer of resistant gene, followed by transformation and transduction. So with this, we come to the end of the topic. If you find my video useful, please like and subscribe to this channel, and thank you for watching.